My name is Wael Ibrahim Elashmawy. I was a marketing director in Xerox Egypt. Married, have one son and one daughter. I didn't have any medical history issues before my heart failure. In January 2018 in Cairo, I had a strange feeling around my chest. I was treated in Cromwell Hospital in London, and I had a medical assessment for heart transplant in Harefield Hospital, also in London. I went to USA trying to be on a waiting list for heart transplant, but it didn't work. Then my cardiologist in London recommended India as a destination for transplant under Dr. Balakrishnan as the best doctor who can treat my heart failure. After arrival in India, my health was deteriorating and I lost a lot of weight. When I met Dr. Bala in MGM Hospital for first time, he immediately diagnosed my case and recommended LVAD as a bridge for heart transplant.
Mr. Wael Ibrahim came to us with end-stage heart failure. He was breathless, he didn't have appetite, his legs were swollen, and he was finding it difficult to breathe, and he was suffering actually. So we did a detailed evaluation. Basically he had cardiomyopathy and severe left ventricular dysfunction. So we worked up and listed for a heart transplant, but he cannot wait till he get a heart. So that was the period we decided about putting the left ventricular assist device. So we took him for surgery, implanted LVAD. LVAD is basically a small pump which will be fitted into the left ventricle. Now instead of left ventricle pumping blood into the body, this device will pump blood into the body. So after the implantation, now his blood pressure is good, the cardiac output is good, he is getting good oxygenated blood throughout his body. His creatinine was actually, it was increasing and he was not making urine. Now his urine output is good. So all the symptoms have improved. So only thing what he needs to do is to take some anticoagulants so that the blood will not clot. Otherwise he is doing a great job. Now his appetite is good, he can walk freely and he is doing all kinds of activities. In fact, when he came to us before, his weight was around 90 kg. That was not because of the muscle mass, but because of the accumulated fluid in his body. So once the LVAD is put, he lost almost 10 to 15 kg weight. All the water, excess water was eliminated by the kidney. Now actually he started gaining weight because he is taking good food, developing muscle, he is getting more strength. So it's always good to see a patient who has done well with LVAD, doing all his activities, and in fact he is ready to go back to his country also.
Now, almost after 8 months of the LVAD, I gained weight and improved my health condition and back to normal activities. I advise international patients like me who have major heart issues and required heart transplants or LVAD to choose the right doctor and expertise to treat them. For me, I always recommend Dr. Bala and his team to treat all the patients suffering from severe heart failure. This is the best team for heart failure treatment.
Pump can work for 10 to 15 years, so without much problem. So it's a good option, especially in patients who are having end-stage heart failure. This will definitely improve the overall survival as well as the quality of life.
I recommend Dr. Bala and his team, especially Dr. Suresh Rao, to come to Egypt to spread their knowledge and expertise. I wish to take my doctors to visit the pyramids and enjoy the Egyptian hospitality. Finally, I thank God and my doctors for everything they have done for me and saving my life.